Have you been suffering with chronic pain for months, years, if not even more than 1 decade, 2 or 3 decades? Have you gone to different doctors who have run various tests, whether it's nutrient deficiency tests, food sensitivity tests, genetic disorder tests, MRIs, nerve conduction tests? Maybe they've done colonoscopies, endoscopies, because part of the pain is internally, in addition to the neck pain and arm pain and leg pain and foot pain and hand pain and head pain. Have you gone through various nerve conduction tests? Have you been through various neurological evaluations? Have you been in the hospital? Have you gone to the emergency room? Are you sick and tired of all these doctor visits and you have not yet found how to overcome the chronic pain? Have you been labeled with different kinds of diagnoses? One doctor says they agree with the diagnosis, another one makes up another label. Maybe you have one diagnosis, maybe you have several diagnoses at the same time that are still leaving you with, how can I get better? My name is Dr. Lonnie Herman, and in this video, like in many of my other videos, I'm going to share with you the incredible results that this woman, let's show you this picture right here, this woman of the kind of pain that she's gone through for more than 2 decades, the shortness of breath, the weakness in her limbs, the pain in the neck, the tingling in the arms and hands, the pain in the legs, the pain around the body. She's had some incredible recovery after her first protocol, and now she's following her second protocol. Right now I'm filming this May 18th of 2019. Her first visit with me was November of 2018, second in February of 2019, 3 months later. She went from being in severe pain for more than 20 years to incredible, sustained reduction in her pain, and you can too. So now let's get into the kind of exam findings that I discovered and the remedies I provided for her to help her get out of this pain. I found in this unique exam process that I offer patients who come to my clinic from anywhere in the world, who come to my clinic that's located right now in South Florida, for a very unique neurological evaluation and pairing it with a bioresonance evaluation. And with the bioresonance, I could find which tissue is infected and what's the infection causing that tissue infection, or what's the infection causing that tissue to not function well that causes symptom expression in the body. I found in her cerebral spinal fluid, and no, there was no spinal tap. And I do, again, it's a very unique bioresonance method, no computer, there's no machine here, there's just a very unique I should say two, me and my female assistant with the patient, with very unique reflex analysis testing that I perform here. I found in her cerebral spinal fluid, which is the fluid around and throughout the entire brain and spinal cord, I found scabies infection. I found the influenza virus. I found the Epstein-Barr virus. I found the retroviruses. I found influenza B virus in her cerebral spinal fluid. Remedies were prepared which removed these infections from that fluid. How do I know? Because I retested her. And how do I know? Because with the method that I practiced, that I provided her of remedies to remove these infections, she's experiencing, for the first time in many years, 20 years, if not more, reduction in the symptoms she suffered for a long time. So we know that we're hitting the mark, and it's real, and it's right. I found also in the cortex of the brain, she had xylocaine local anesthetic, which is from an epidural years ago. She had influenza B virus in the cortex of her brain. She had xylocaine also located in the cerebellum of the back of the brain. She had xylocaine in her liver, and remedies were provided for those as well. I found also that the vertebral arteries, which bring blood to the spinal cord and the back of the brain, I found the influenza virus. I found the influenza virus in her brainstem tissue. I found Lyme infection in the pia layer of her meninges, the layer pia mater it's known as. It's the closest layer with blood vessels and nerves that are deeply invested into the brain and spinal cord. When the meninges were infected, we don't have to go blind. We don't have to have some really strange kind of fever disorder. You can have infection in the meninges of a virus like that or Lyme, and that can cause inflammation and stress into your whole central nervous system and lead to a symptom. If a doctor doesn't know how to look for that, you can be going on years of a horrible, painful disorder and a seemingly never-ending journey living with the chronic pain. I found in her left kidney that she had dental mercury, she had gold from a crown, she had xylocaine local anesthetic chemical from injections in the past in her left kidney. Remedies were provided to remove these 3 chemicals. I found Lyme infection in her aorta, which is the main blood vessel that goes down from the heart down to the body and brings blood to all different parts of the body. I found Lyme infection in that aorta. She told me something really interesting. She sent me an email, Dr. Herman, I felt, right after I took the remedy for the Lyme in the aorta, I felt the chest pain I suffered for years. It was like an hour or 2 after I took the remedy, all the chest pain was gone. Gone chest pain. And it had not returned even when I saw her in February, and it still has not returned, which now is May of 2019. Lyme in the aorta, got rid of it, chest pain gone, incredible. I found that she had xylocaine local anesthetic chemical in her glial cells, which are the cells that repair and reproduce the central nervous system tissue. How is your nervous system going to function when you have local anesthetic chemicals that are stuck in there? They don't just pee it out. It doesn't just leave the body. We are what we eat. We are what we, if we drink, smoke, whatever you chew on, like gum, chemicals get into you, and even what you're injected with, they get in the body and they don't just leave the body. Don't be fooled into thinking that they do or believing that they do. They don't. I also found that xylocaine local anesthetic was on her thyroid gland, making the thyroid malfunction and making it sleep, so to speak. I also found that her lymph was toxic with general anesthesia chemicals called propofol, and I provided her remedies to get all of these infections and chemicals out of the tissues, and she came back, and as you'll see in this video of her description, her incredible recovery, her incredible reduction in pain and shortness of breath and weakness in the legs and chest pain and so on. Watch that video. If you're suffering chronic pain, watch this whole video. Rewind it, listen to these findings again, listen to her description again. It's just incredible. It's incredible. In her second exam in February, I found that she had chlorine, fluoride, mercury dimethyl methyl chloride, silver mercury compound, lidocaine local anesthetic, because she just had some dental work between the first and second visit, amoxicillin residues in her kidneys. Also, part of what was making her sick, she's for years used pink Himalayan sea salt, and the sea salt carries whatever is in the ocean. It has mercury on it. So the mercury, little drips of the salt every day or every other day getting into the body, the mercury compound stuck in the kidney, making her ill. I found and provided remedies to remove all of those that I just listed. I found in the renal pelvis tissue in her kidney. They're like funnels inside the kidney to help to siphon the urine out of the kidney to go down the ureter to the bladder. I'll show you an image up here of the renal pelvis. She had malaria, E. coli. Malaria doesn't only happen in like the Amazon jungle or some other part of the world. Excuse me. These mosquitoes can carry parasite infection and viral infection and bacteria from any kind of organism. Can be in the mosquito and they're injecting it and giving it to you. I found the malaria, E. coli, black mold in her renal pelvis tissues. I found her ureters and the renal artery, which brings blood to the artery. I found the ureters and the renal artery, black mold. I found her adrenal gland on the left and the right organ, kidney. The left and right adrenals, malarial infection. I found that she had malaria and black mold in her left kidney. I found malaria and black mold in the right kidney as well. I found the hypothalamus of the brain, which controls the thyroid and the pituitary and all other hormones of the body, including some organ function, including heart rate. I found malaria and black mold in her hypothalamus. Remedies were provided for these. This protocol is a 2-month protocol, which I see her again very soon. She'll be coming in very soon to my clinic, and I'm looking forward to even more improvement. I will tell you that sometimes when people follow these protocols and they're getting rid of infections, sometimes there is an exacerbation of pain because the immune system is going after these infections and chemicals and the body is struggling to get them out. That inflammation can occur during a disinfection and or a detox process. Sometimes that happens. Sometimes it doesn't. It's just a beautiful outcome. Sometimes it's struggle to get to the beautiful outcome, but the beautiful outcome will come when we remove what we find are causing the condition. So in this very unique method I practice, once again, I can pinpoint and safely remove these deep Hidden disease-causing infections and toxins deep in the tissues of the brain, of the spinal cord, of the liver, the pancreas, the bones, the organs, the uterus, the ovary, wherever, the heart muscle, the heart valve, we can find them and remove them. And then you can feel better. Until you can remove these hidden disease-causing agents or pernicious agents, I don't think that you ever really have a chance of full recovery. Once again, my name is Dr. Lonnie Herman. I'm here to help you get well. Watch the other videos on my YouTube channel. I'll put up some other custom thumbnails here so you can see some other incredible recovery patient experiences that we can share with you. I look forward to helping you. You can contact my clinic at 954-370-3100. That's 954-370-3100, or send an email to my clinic assistant at office.askdrherman@gmail.com. That's office.askdrherman@gmail.com. My assistant will be happy to answer a few questions that you may have. She's going to send you some paperwork so you could fill out. Get me your evidence of labs or other doctor's visits you've had done. Send them in to me before you're going to have your consultation with me. First is the investigation consultation appointment, and then is going to be an examination, unique exam appointment. The consultation investigation is a 1 hour appointment. The exam investigation appointment is usually a 2 to 2.5 hour appointment. Very in-depth, very thorough, very involved exam, and description of what I found in the exam, and telling you how to follow a protocol with removing these infections and toxins from your tissues with these specific, very powerful, potent remedies that will get the job done for you. Just know that unfortunately insurance companies don't recognize this work, so this will be an investment in yourself, and you are the #1 item on the planet. You are more important than your house or the jewelry or the car or the vacation. When you're suffering, nothing else comes first. Health comes first. So you're going to invest in yourself. You're investing in yourself to get better. Okay? You can follow me on and like me on Facebook, as well as Instagram and Twitter. I put up information on those other social media platforms on a pretty regular basis. You can watch other testimonials, some other videos of me describing what I'm finding in the tissue. It takes some diligence, it takes dedication, it takes knowledge in various areas, which I have in neurology and neurochemistry and immunology and endocrinology, blood chemistry analysis, thyroid disease, gastrointestinal disorders, movement disorders, vestibular rehabilitation for vestibular disorders, which means balance disorders, cardiology, biochemistry. I've taken a lot of postgraduate studies over the past 12 years. And I believe I've got the right tools and the right method to help you overcome your chronic condition. And I look forward to be able to help you be one of the incredible, successful patient recovery stories shared on my YouTube channel. All right, look forward to helping you. Contact my clinic via phone or email, and we'll see you soon.